This is the second part of our video, and today we will is our 21st question to 15th question. So, the question number 21. In skeletal muscle, which of the following events occurs before depolarization of the T tubules in the mechanism of excitation contraction coupling? A. Depolarization of the sarcolemmal membrane. B. Opening of Ca2 plus plasmic reticulum. C. Uptake of Ca2 plus into the SR by Ca2 plus adenosine triphosphatase. D. Binding of Ca2 plus to troponin. E. Binding of actin and myosin. And the answer is A. Depolarization of the sarcolemmal membrane. And moving on to the 22nd question. A new drug is developed that blocks the transporter for H plus secretion in gastric parietal cells. Which of the following transport processes is being inhibited? A. Simple diffusion. B. Facilitated diffusion. C. Primary active transport. D. Port transport. And E. Counter transport. And the answer is C. Primary active transport. And moving on to the 23rd question. Following a sympathectomy, a 66-year-old man experiences orthostatic hypotension. The explanation for this occurrence is A. An exaggerated response to the renin-angiotensin-aldosterone system. B. A suppressed response of the renin-angiotensin-aldosterone system. C. An exaggerated response of the baroreceptor mechanism. D. A suppressed response of the baroreceptor mechanism. E. None of the above. And the answer is D. A suppressed response of the baroreceptor mechanism. And the 24th question. A 42-year-old woman with severe pulmonary fibrosis is evaluated by her physician and has the following arterial blood gases: pH 7.48, PaO2 55 mmHg, and PaCO2 32 mmHg. This statement best explains the observed value of PaCO2. A. The increased pH stimulates breathing via peripheral chemoreceptors. B. The increased pH stimulates breathing via central chemoreceptors. C. The decreased PaO2 inhibits breathing via peripheral chemoreceptors. D. The decreased PaO2 stimulates breathing via peripheral chemoreceptors. E. The decreased PaO2 stimulates breathing via central chemoreceptors. And the answer is D. The decreased PaO2 stimulates breathing via peripheral chemoreceptors. And the 25th question. Which of the following has a much lower concentration in CSF than in cerebral papillary blood? A. Na plus, B. K plus, C. Osmolarity, D. Protein, E. Mg2 plus. And the answer is D. Protein. And the 26th question. An electrocardiogram ECG on a patient shows ventricular extrasystoles. The extrasystolic beat would produce A. Increased pulse pressure because contractility is increased pulse pressure because heart rate is increased, C. Decreased pulse pressure because ventricular filling time is increased, D. Decreased pulse pressure because stroke volume is decreased, E. Decreased pulse pressure because the PR interval is increased. And the answer is D. Decreased pulse pressure because stroke volume is decreased. And to the 27th question. After an extrasystole, the next normal ventricular contraction produces A. Increased pulse pressure because the contractility of the ventricle is increased. B. Increased pulse pressure because total peripheral resistance TPR is decreased. C. Increased pulse pressure because compliance of the veins is decreased. D. Decreased pulse pressure because the contractility of the ventricle is increased. E. Decreased pulse pressure because TPR is decreased. And the answer is A. Increased pulse pressure because the contractility of the ventricle is increased. And the 28th question. The ventricles are completely depolarized during which isoelectric portion of the electrocardiogram is this? A. PR interval, B. QRS complex, C. QT interval, D. ST segment, E. T wave. And the answer is D. ST segment. And the 29th question. Receptor potential in a Pacinian corpuscle. A. Is an all or none phenomenon. B. Has a stereotypical size and shape. C. Is the action potential of this sensory receptor. D. If hyperpolarizing increases the likelihood of action potential occurrence. E. If depolarizing brings the membrane potential closer to threshold. And the answer is E. If depolarizing brings the membrane potential closer to threshold. And the 30th question. A patient has the following arterial blood values: pH 7.52, PCO2 20 mmHg, HCO3 minus 16 m equivalent per liter. Which of the following statements about this patient is most likely to be correct? A. He is hypoventilating. B. He has decreased ionized CO2 plus in blood. C. He has almost complete respiratory compensation. D. He has an acid-base disorder caused by overproduction of fixed acid. E. Appropriate renal compensation would cause his arterial HCO3 minus to increase. And the answer is B. He has decreased ionized Ca2 plus in blood. So, 31st question. A patient with a duodenal ulcer is treated successfully with the drug cimetidine. The basis for cimetidin's inhibition of gastric H plus secretion is that it A. Blocks muscarinic receptors on parietal cells. B. Blocks H2 receptors on parietal cells. C. Increases intracellular cyclic adenosine monophosphate levels. D. Blocks H plus K plus adenosine triphosphatase. E. Enhances the action of acetylcholine on parietal cells. And the answer is B. Blocks H2 receptors on parietal cells. And the 32nd question. A 24-year-old woman presents to her family physician with intractable hiccups. The patient is instructed to breathe into and out of a bag in order to rebreathe exhaled CO2. In the blood, the majority of CO2 is transported as which of the following forms? A. Bicarbonate, B. Carbaminohemoglobin, C. Carbonic acid, D. Carboxyhemoglobin, E. Dissolved CO2. And the answer is A. Bicarbonate. The 33rd question. Which of the following explains the suppression of lactation during pregnancy? A. Blood prolactin levels are too low for milk production to occur. B. Human placental lactogen levels are too low for milk production to occur. C. The fetal adrenal gland does not produce sufficient estrogen. D. Blood levels of estrogen and progesterone are high. E. The maternal anterior pituitary is suppressed. And the answer is D. Blood levels of estrogen and progesterone are high. And the 34th question. A 63-year-old woman has an intractable duodenal ulcer following all previous treatments. After consultation with a surgeon, a laparoscopic vagotomy is performed. Subsequently, the patient experiences nausea and vomiting after ingestion of a mixed meal. Which of the following best explains her symptoms? A. Decreased gastric emptying of liquids. B. Decreased gastric emptying of solids. C. Increased gastric emptying of liquids. D. Increased gastric emptying of solids. E. Increased gastric emptying of solids and liquids. And the answer is D. Decreased gastric emptying of solids. 35th question.